So it's really, really great to be here. Now, my name is Aisha Thomas, and I am going to be chairing today's panel, which I promise you will be really amazing and very interesting. And we're going to be thinking about the need for anti-racist leadership in the NHS. And it's an interesting one, because I think whenever you hear the words anti-racist or you hear racism, I'm very aware of the different thoughts and feelings and emotions that might come flooding in. Like, oh my gosh, is she going to call me racist? I promise you, I'm not going to do that. But what we are going to do is we're going to think about how we've learned lessons through Black Maternity Matters, which has been a really innovative program that has taken people on a real journey. It hasn't been about tick box exercises. It hasn't been about painting by numbers and putting people in front of a computer screen. It's been about holding people. It's been about honesty. It's been about connection. And it's been about changing people's lives. And so having you today here as audience members who want to be in this space with us, that speaks volumes to the differences that we're trying to make. We know how important this is. And we know what this means. So we want to say a massive thank you for choosing to come into our session today. Now, to really get us started, the best way we could possibly sum up what we can do today is really thinking about the Black Maternity Matters program by watching a short video that we'll introduce. But before we do that, I first of all just want to pop the QR code on the screen for us, if that's okay, because this is a chance for you to kind of think about any questions that you might have as you're watching the video, any questions you have whilst we're going through the panel. And it's an opportunity to allow your curiosity to come out. Probably the things that you want to ask but never really want to say, this is your opportunity and your moment. And then after we do that, we will be welcomed by a wonderful panel where I will introduce to you Maria, Dawn, and Steve. But until then, we're just going to hold fire for a second, and we're going to start with our amazing film that will give you a real insight to why we do what we do. So thank you for watching.
Black Maternity Matters is inspired by the vision that one day women racialised as black will no longer be disproportionately in danger during pregnancy and the first year after birth of their babies. The statistics are grim. When I had my youngest child, I learned that as a black woman giving birth in the UK, I was 5 times more likely to die during childbirth or up to 6 weeks after. The statistics continue to tell us that black babies are more than twice as likely to be stillborn. We've developed an innovative 6-month anti-racism education and training programme designed specifically for staff working in maternity and neonatal services.
This is very innovative and quite revolutionary. Most people are used to getting a 30-minute e-learning module, and we're saying commit for 6 months of your life to go on a journey with us. It is a vast difference in approach, and it's a real immersive practice that we're providing people to step into.
The journey invites our participants to get introspective, to think about who they are, their belief systems, values, principles, their understanding of race and racism. Okay, so we start with building some foundations for them, okay, doing a bit of myth busting, especially through the lens of their profession.
Black Maternity Matters is making a difference on so many levels, but I think most significantly is the transformation of individuals and teams and organisations to really embrace and embed anti-racist practice and theory.
Everybody that comes on Black Maternity Matters programme, I'm doing it myself at the moment, I'm currently one of the participants, and it is a total transformation. You are learning so much and you're unlearning a lot as well.
Unless we're actively anti-racist, we are passively allowing racism to continue in a systemic way. Definitely everyone in the NHS needs to have the opportunity to really examine what racism is, where it's happening and what their part in it is. Are you passively allowing it to happen, and how do you stop that? Because most of us are passively allowing it to happen, and I never thought I would say that.
What's been really beautiful about this work is we now have a cohort of leaders, and that's a beautiful opportunity because we have the people in the system who have the power to make institutional change. that's transformational, because not only are we talking about what we do on the ground, we talk about policy, systems and guidance, and that's when we can really begin to see the ripple effects of our work. That's massive.
Because the power that they have, and when they get it, they really get it, and they can really make a difference. So it is very, very exciting, a little bit daunting because it feels as though it's getting very big, and I think that's one of the reasons that we've wanted to take our time, is because we've always wanted to keep the integrity of the programme and not to lose that.
Our ambition and goal for Black Maternity Matters is that it's in every NHS trust across the UK, and that it really is embedded, and the anti-racist practice and theory and the compassion and kindness and collaboration it brings is just part of how we work in the NHS.
We started our community groups bringing together black women in Bristol about 3 years ago, and when we started, when people would come to us and share their nervousness about leaning into NHS services, there wasn't much we could say. But now we're on phase 4 of Black Maternity Matters. I'm proud to say, with a bit more confidence, I can say actually there are lots of people that are working in the settings that you're going to be engaging in that are on this journey and are committing to doing better by you.
Wow, what a video. Really, really brilliant. And it allows you to begin to feel some of the emotion. So when we think about the focus of today's panel, we're really going to think about anti-racist leadership in the NHS. And we're going to think about this across the public sector more widely. And we really want the chance to share our learning, our insights, our thinkings, what went well, and perhaps some of our challenges if we really want to think about the adoption of this approach. And so we are very blessed to have people who have taken part in our first leadership cohort to kind of share their experiences, their training, and how they're implementing change given the experience they've had. So I'm going to start by welcoming our very, very amazing panelists that we have today. So I'd first of all like to welcome onto the stage for me Maria Kane, who is the Chief Executive of North Bristol NHS Trust and University Hospitals Bristol and Weston Foundation Trust. Welcome, Maria. I'd next like to please welcome Steve Hams, Chief Nursing Officer of North Bristol NHS Trust. And now I would like to invite Dawn Morrall, Clinical Lead, Maternity Transformation Programme, Gloucestershire, Local Maternity Neonatal System. Welcome. All right, so now we're going to get into a really good conversation. I think one of the most amazing things about being part of Black Maternity for me is the transformational journey that we get to watch. It's seeing the change happen in front of us in real time. And my colleague Katie, who's in the audience, give everyone a wave, Katie. We work really hard at crafting opportunity for people to sit in that discomfort. And we had a training session last week, and what we likened it to was you almost get this EastEnders duff moment where we kind of just leave you hanging so that you can just kind of sit in it and go, what's going to happen next? But nobody can tell you better than the people who actually go on the journey with us. So I want us to start thinking about the programme and your experience. And I want to start with you, Dawn, if that's okay. And you're quite unique because you got to do the perinatal training session, but also the senior leader. So I just want to hear from you. What was that experience like? What was the difference?
Okay. Thank you. First of all, I want to say how honoured I am to be amongst these eminent people here. Don't know why I'm here, but I am. The film is amazing, and I don't know what you felt, but gave me goosebumps. Just maybe that's because I've done the training, but it absolutely sums up what the training is all about. I have a few notes because I feel so passionately about this training that I'm likely to go off-piste and go over my time. So I think the training, it is unique because it's specifically and purposely about anti-racism and women's outcomes and experiences in maternity services when they're racialised as black. Statistics, in case you missed them, are really stark. Sonna in the film, Sonna Patton from Black Mothers Matter, tells us that black women are more likely to die than women racialised as white just because of the colour of their skin. And in 2024, it's not acceptable. I have to say something about the Health Innovation Network for bringing together this amazing collaboration. You know, bringing together health innovation and all their expertise with Aisha and Katie, these inspiring people, to bring about this training is amazing. And without them, I don't think we'd be talking about anti-racism on this stage today. So I'll talk about my own journey because, as Aisha said, I've done a perinatal cohort and the senior leaders. And why did I do that? I'll tell you a little bit about the journey of Black Maternity Matters in case you haven't heard where it started. So it started in Bristol with the first cohort, and that was aimed at midwives only. And I became involved because I'm the clinical leader for Gloucestershire LMNS, and Anne and Nushin from the Health Innovation Network approached myself and my colleague from Bath, Swindon and Wiltshire to try to spread the anti-racist training across the West of England Health Innovation Network. And we did have the offer of some funding, but that didn't provide us with the backfill to release the midwives to go on the training. So what we did was we decided to make it perinatal, and that was the right thing to do. So we had a whole perinatal team, including doctors, midwives, health visitors. And one of the good things about that was the really good multi-professional working that we were able to achieve on a lot of the QI and the service improvement projects. And they were large and small, from silk bonnets on our delivery suite to engaging with Black Mothers Matter to set up a programme like that in Gloucester for our black women in Gloucester. And I also had some feedback from the team, the perinatal team at the time. So being a senior leader on the perinatal cohort, they were grateful that I was there because I could unblock some of the blockages that they were experiencing in the clinical areas, but also suggest different ways to find funding and pots of money. So as the film says, and Aisha says, the training is absolutely unique. It's immersive in the way it's delivered with various touch points over 6 months. And I think probably when you say the training is over 6 months, people take a sharp intake of breath because that's a long time for people to be on a course and released from clinical duties in the NHS. But it's spread over the 6 months with face-to-face sessions. There's a book club, so you can really immerse yourself, and discussions amongst the group. And then there's the quality improvement sessions led by the Health Innovation Network, which are fantastic. But most of all, there's the WhatsApp group where we all connect.
That's if you like a WhatsApp. Me now, but I get it.
It was really, really brilliant to be able to have just those conversations. I've seen this. Here's a resource. Here's a podcast. Share it. It's really, really great, and it's part of that whole package.
Can I ask you a question, Dawn? Because
Yeah.
I think I love the way you've explained it and you've really talked us through what the programme is and almost the logistical bit. But I guess I just want to think about you just for a moment. What's the legacy it's left in you?
I'm getting there.
All right, Dawn.
I'm
All
getting
right,
there.
all right.
I've got
I'll
over
stop.
my
I'll let
time.
Dawn do
I told
it.
you I had to keep a script.
I love it.
So on both courses, the perinatal and the senior leaders, the content is, to start with, very uncomfortable, especially at the beginning when we're on this journey. And the journey takes us from being, as it said in the film actually, non-racist, passive observer to anti-racist, being anti-racist and active in the space. So people change as they work through the 6 months, and they emerge in a very different place to when they started, and I definitely did. You see everything through an anti-racism lens, and you get it. And that's one of the things. You get to the end of the course, you absolutely get it, don't you guys? So having attended both courses, I can see that both have their value and should run alongside each other. It's essential that you have senior leaders on board within the organisation, because they can make a difference and can affect the sort of systemic changes that need to happen within our organisations. And on the senior leaders, it involves everyone across the spectrum. So involves our higher education institutes. So we had some senior leaders from the University West of England who were leading on the student midwifery curriculum. Yeah. And they were so inspired, they were going back to decolonise the midwifery training, the education programme, and also to look at applicants because black and brown students were underrepresented in midwifery training, and they absolutely are. So there's loads of examples like that. But I think I'll pass over.
That was very comprehensive, Dawn. I like it.
I
like
wanted
it.
to take you through the journey.
That's all right. I don't mind. You can just tell there's an endorsement here from Dawn. Thoroughly explain what we do. Thank you so much. We're going to recruit you to do all of our campaigning for us. All right. So, Steve, I want to bring you into the conversation, but I want to change it slightly. So we know what the course is. We know that during the course there's this change. I want us to delve into that. So I'm going to ask you quite a loaded question. What was your defining moment?
Thank you. Before I say that, though, I would pay just tribute to you and to Katie, two incredible women who've changed my life. Thank you. I said I wouldn't get upset. So, as you can tell, there have been many defining moments through the last 6 months, and you have changed my life, and you've put me right through the ringer, I would say that. But
we're not that bad, I promise.
But it has been the most transformative 6 months of an immersive programme where you truly get to experience what it's like. And I came into the programme, I've got mixed heritage, auntie, cousin, and I thought I understood what racism was all about. I was coming in thinking, as a white privileged man, I get it. You know, I kind of understand. There's probably something to learn here. Geez, I didn't know anything. And I think I'll just say before coming to the question is, what you two helped us do and the whole group helped us do was just sit with a huge amount of discomfort. And I think unless you feel that discomfort, you never truly understand. We talked about white privilege and white guilt and white shame, and the role that we have as white people, but particularly white men, in enabling others' narrative to come through. And the whole part of Black History Month was about changing the narrative and people owning their narrative. So part of, for me, at the end of the programme was for me saying that, I have a number of options with my white privilege. I can do bad with it, I can do nothing, or I can do good. Mm-hmm. And I think I've chosen the right one. So I'm still on that journey. But the defining moment, there were two defining moments. One was a personal one, and I was talking to a colleague who I absolutely admire. She's a black woman, and I remember having a conversation with her saying, "It's a bit tough, isn't it? This is hard work. They're stretching my thinking all over the place." And there was a pause in the conversation on the phone, and she said, "Will you just listen to yourself, white boy?" At the end of the day, you go home and you can forget about it. Yeah. Steve, I know you probably won't. You can forget about it. But me and my black skin, I worry about my kids when they go out. I worry about it when I go to bed. I dream about it. I get up and I worry about it. And it was that moment personally when I went, okay, shut up, learn, engage, and listen. And then there were many moments during the programme itself. And the one that struck me is the wet nurse. And I'd heard the term, but never truly understood what it meant. And that says something to me about not only being a white person, but a man. And you showed an image, and we talked this morning about whether we should show that image here and the importance of not showing it because it would distract from the words that I think I'm about to show you. And importantly, both of you held us all in this imagery of the most amazing, beautiful, enslaved black woman with a white child breastfeeding it. And then you showed an opposite image of a white woman with a black child. And the real juxtaposition in my mind just kind of blew it. And I was kind of horrified that women do this. But I was horrified that black women did this and enslaved women in the colonial past. And you shared an incredible poem, which I'm going to read here. And having done some research on it since, it's a really controversial poem.
Yeah.
Particularly amongst white women. So it's by Hess Love. I wish I dried up. I wish every drop of my milk slipped past those pink lips and nourished the ground, where the bones lay of my babies, starved while I feed their murderer. I wish I dried up, so the missus' babies would dry up too and be brittle, so I could crumble them to dust, return them to the ground, where all children of my bosom lay equal. And it was such a profound image, and the poem and the generosity of you two, particularly in sharing that, was just a real moment where I just thought, this is a duty to make this different. And, Dawn's already said the outcomes for black women and black babies in 2024 is unacceptable. And we have the power. We have positional power. I have privilege. I'm a man. And therefore we have a duty to try and put some of that stuff right. And there's one other moment, if I may.
Yes.
And it's around reclaiming words. And I remember, Katie, you using the word brown. And it was quite early on in the programme, and I thought, you can't use that. And you beautifully said to me, it's my word. I'm owning it. I've reclaimed it. And I went, okay, I've got it. I've got goosebumps even thinking about that. So there were many moments over the last 6 months where it's totally transformed the way that I think and my energy and my commitment to trying to use my privilege in a way that enables others. And I hope we see that. I've got some amazing colleagues here where we're trying to put some of that right.
Just before I bring Maria in, is there one thing that you'd want to share that you have done differently? I appreciate you haven't got lots of time to go into detail of everything you've done, but is there just one thing that you'd want to share with the audience that you've chosen to do differently before I bring Maria in?
I think for me it's the confidence that the programme has given me in talking.
Okay.
Because in the absence of talking, you can ignore. It's easy to ignore. And just talking in the confidence about some of the words, and I remember us having conversations about words, has given that confidence to talk about it and to challenge it and to encourage others to talk about it.
Awesome, thank you.
Thank you,
All right.
And
So, Maria, you're not getting off the hook. You're up next. But it's funny because Katie and I, during our delivery, we do a lot of people watching, and we kind of do this little thing between ourselves, and we go, who's going to be trouble? Who's going to be a problem? Who do we need to watch out for? Who's really poised? And I remember saying to Katie, what's Maria thinking? What's her thoughts? And at that time, we didn't know who you were. So that's a good thing. We had no idea of the ranking. And we're going, who's that woman? What's she thinking? Because you were so poised. I was thinking, And then you came and spoke to us, and I was like, she gets it. So Maria, talk to us. What happened to you on the course?
Well, so perhaps a little bit unlike me, I felt quite overwhelmed and speechless, I think, rather than talking. I felt I had to listen in a very different way, actually, than perhaps we might all consider we listened. Two things that impacted me immediately, and I'm reminded of the phrase, and I saw it in Katie and Aisha, people who bring energy wherever they go rather than whenever they go. So, you had that energy with you all the time that was captivating and that drew people in. The way you described both your own experiences and historical perspectives, etc. I just went home after the first couple of sessions and thought, why on earth didn't I know this before? How on earth have I got through my life and into the position of privilege I'm in, paid for by public money, and I haven't taken the time or put the effort in to go and find these things out? And this started in COVID. Also, as a hospital manager, I see the statistics that Sonna typified and talked about today. We review them, don't we, in our safety meetings. I look at the figures about who we employ in our trust. It's nothing like our population. I look at our senior managers. I think of Roger Klein's snowy white peaks at the top of most public sector organisations, too hot to handle, a damning indictment really of what's going on in some public sector institutions. So that food for thought made me come back in my position of huge privilege and say, I can't now do nothing with that. And that's when, actually building on the work that so many colleagues have been doing for some time, and given the theme of this conference actually with Health Innovation West of England, we thought about how could we accelerate this? How could we pilot and adopt? And so I'm very lucky at North Bristol Trust. We decided to pilot some anti-racism training with Black Maternity Matters, and we had our first session last week. Thank you. And I've just got the feedback from that session, and I'm looking at the words. This course will turn my life upside down. I'm overwhelmed but engaged. I want to be celebrated, not tolerated. I am very uncomfortable. And uncomfortable, sitting with that discomfort was another huge feeling that came, shame, guilt, all sorts of things, but it was absolutely palpable. And I can see in the 50 colleagues who attended this training, they felt the same as a result. There are things going on in both of the trusts that I work at. So both trusts, I'm delighted to say, at board level have committed to being anti-racist organisations, and that's a very easy word to say, or phrase to use rather. What it means is we are very much at the beginning of a commitment to a journey to be very uncomfortable and to start educating ourselves and to take our responsibility to do so, and to commit to training programs in both organisations that will have our colleagues who do understand fairness and compassion, but sometimes remain ignorant about being racist, consciously and unconsciously. And sometimes we surround ourselves with people and we become an echo chamber and our views aren't challenged in a way. So trying to do this respectfully. And I felt after going through the Black Maternity Matters Leaders Programme, we would have that done very, very well with colleagues in the NHS. So that has started. We've made some other commitments in that, I suppose, principle of you have to see it to be it. We have committed at NBT, North Bristol Trust, to having 12.5% of our senior leaders from global majority backgrounds by 2026. Now that sounds like nothing given our local population, but it's less than 4% at the moment. So really trying to move that forward. In the session I was in earlier, Michael Marmot talked about anchor institutions. How do we positively and affirmatively go out to our local communities? Where often, deprivation is a proxy for our population and how it's segmented. How do we go out, inspire, aspire, ensure that people are able to work and to start a journey? We have apprenticeship schemes at University Hospital Bristol and Weston. Really fantastic Bridges programme where 80 colleagues are stepping up in an accelerated way to take on leadership roles. Anti-racism statements, 14 workshops have happened in the last month where people are sitting and listening and just hearing the feedback for how life really feels. But so much more to do, the very, very start of it. Hearing about microaggressions, raising awareness, raising consciousness generally, but back to what I said at the start, listening in a different way. I'm used to jumping in and going, I've got the answer here, it's part of my role. I'm really having to shut my gob and respectfully listen. And I'm so delighted. I've got colleagues around who want to do the same. And I do also want to say a huge thank you to you and to Katie. It has been transformative. I feel a different person. So I'm very, very grateful.
Thank you. So we're now going to go to some of the questions that we've had coming in. And there's been a number of different questions, some of which have been answered as we've gone through, but some of which I think would be interesting for you to think about. Now, people often say to us, well, who is your training for? We have to be quite honest. Our focus is very much designed with those who are racialised as white in mind in terms of taking them on a learning journey and experience. But this question really gets me thinking, and I would like to offer it to the panel. Anti-racism practice and culture shifts include protecting and retaining global majority staff. What practices do you have to ensure staff are safe, thrive and able to be promoted and developed? Who would like to start?
I can
yes,
start.
Please.
So we now have diverse recruitment panels. So every single panel now, I think we became very aware that many of our practices are racist when we go about recruiting. Ridiculous amounts of qualifications required that, really imply you've had a privileged background, you've been able to study for masters and greater qualifications, and that you've had the economic circumstances to be able to do that. So really looking at what the job requires without the usual qualifications that are needed, having diversity of thought on our panels so that we don't just recruit in our own image and likeness. Some of the interview techniques, which quite frankly have always favoured white, well-educated, public speaking, people who like to say the word I a lot, not really understanding many of our beautiful cultures where humility is prized and where people talk about we a lot, quite rightly, because we are only ever a part of a team for our success. So that those sorts of things, positive action, going out into the community, advertising differently, retaining staff, and actually we had really good success with that in both trusts by some of the workshops we've had, the changes we've made. Both trusts have EDI advocates and champions. At UHBW, there's 100 EDI champions and ambassadors. So people have lots of ways of telling us how we feel, and incrementally. And I'm aware, again, when we talked about innovation earlier and healthcare innovation, incremental rather than organic, huge change. And do we take that step? And I think that's something we need to start thinking about now. What's that huge step rather than this these tiny, tiny steps that sometimes energy dissipates or pressure is too much and we let go of them in the NHS and we don't keep the pressure on.
Okay. Just on that, but I'm going to add to it, Steve, for you, because I think you could also just do this little bit as well. When we think about staff, particularly those racialised as black and brown, who are in the process of watching their colleagues grapple and almost have to work out how much they believe this to be true or not be true from their lived experience, what are the cultivated spaces of safety or bravery for those staff whilst this is happening for their colleagues?
So, I mean, again, we've done some work at North Bristol around creating those spaces and safe spaces for people to have those conversations. And I'm particularly reminded when there were the riots over the summer.
Yeah.
And the amount of space that we rightly needed to create for people to share their fear and the discomfort. And we did a number of sessions at North Bristol where we collectively held everyone, but we particularly held our black and brown community and our colleagues. So we try really hard to do that. I'm not suggesting we're always successful, but we try to create the space. I mean, I think back in relation to the first question, there is something, and I hear this a lot from colleagues, is, well, you need to put your money where your mouth is. So you can go on the training and do all that sort of stuff and talk nice words. But if I can't see me up there, how can I be ambitious? How can I achieve and aspire? And Rosie Shepherd, who's the chief nurse for the ICB, is leading some work across the southwest around aspiration, the 90-day challenge, about increasing the number of global majority colleagues in senior nursing midwifery leadership positions. But the thing I'm really proud of at MBT is the work that we're beginning to do about identifying the most incredible talent. One of those is sat in the front row, sorry, Surya, but others who are coming forward, having the confidence and the courage, because the environment we're trying to create, to say, I can do this. In fact, we have a thing at NBT led by Gifty Markey, is the Yes You Can campaign, where 2 years ago we profiled 75 of the most inspiring black leaders, but most of them, if not all, were at band 7. And if we're really going to change the narrative and the look of what we're about, we have to change that. And we're beginning to change that. Up until very recently, Gifty was the most senior black nurse in the Southwest. I'm delighted and proud that she's an MBT nurse, but I'm ashamed that there's only one. And, you know, we've had conversation after conversation about, well, we've got to do something about it, haven't we? Yeah, we've got to do something about it. Well, the only way you do something about it is by putting your money where your mouth is and really, truly committing to it. And that's a struggle. People talk, but they don't commit to the action.
Yeah.
So I think, you know, there are a number of examples where we're trying to change the narrative and give people the opportunity. And I think, if I may, just one other point, we've got an issue in midwifery, a real issue in midwifery around diversity. So midwifery leadership generally across the country, my reflection is it's very white. And in our own organisation, that will be the same. So I think it's going right the way back to the aspiration of young people and encouraging them to consider midwifery as a career, but particularly global majority or black and minoritized kids, that midwifery could be the place where you can aspire but be ambitious and really transform communities and people's lives. We all have a commitment to that, but I don't think we're doing that well enough at the minute, particularly in Bristol, where we should be doing that.
Thank you very much. We started slightly late, so I'm going to squeeze in one more question. And Dawn, this is for you. Okay. One more question. The unlearning, as you know, is huge. And particularly for senior staff, you think about the distance and the gap from when they were last trained to then thinking about those who are coming through now, and really not seeing much shift in terms of the qualification and the kind of racial and cultural literacy in that. How do we begin this unlearning for senior leaders? How do we accelerate it from your perspective? What do we do?
I think these two are a really good example of how we do that, and that's the importance of having the senior leaders, Black Maternity Matters cohort, because without people like Maria and Steve experiencing that training, because it's only once you've been through it, like Steve said, you go there thinking, I'm not racist, I can, but when you get to the end, you absolutely get it. And without people, this is the power, isn't it, in these organisations. I have to say, in Gloucestershire, we are a little behind what you guys are achieving, because I think it's amazing what you're doing. And if we could take a little bit of that everywhere, it needs to be in every trust. It needs to be across the country, because if we're going to make a difference, we can't just have Bristol leading the way. We've got to have it across all organisations. And I remember, Steve, on the course, do you remember your ambition was you were going to make Bristol anti-racist, the whole of Bristol. So, you have
Katie,
ambition,
Aisha,
and
help.
I admire that. It's really, I admire what you've done. But I think we need to be doing it everywhere. And I think it starts with the chief exec. And it was quite unique, wasn't it, to have Maria as a chief exec on the course.
And the funny thing is, Kate and I had no clue.
Yeah, but what a difference that can make, because you then start to look at your senior leaders and the the representation of black and brown people at that level. So I think that's it. They've got to run side by side, as
Absolutely.
I said, both courses. Awesome. But this is really important. This is the power and the influence.
Aisha, could I just make one follow-up?
Yes,
if that's
please.
okay. It's about the unlearning,
Yeah.
which is so important, because you basically have to peel a lot back. And I thought about the energy all of us have spent, or many of us have spent, doing the yeah, but, and the defensiveness, and what it takes to get those barriers and to work to sell your story back to yourself about why you haven't done more. And so letting all of that drop and just going, I now have to absorb, I think that's where we need to start our baseline from, just getting rid of all that and putting that energy into rebuilding and learning properly. So, great lesson.
Absolutely. I think if we had one word to give you today, it's acceptance. It's time for us to accept, and then we need to move forward. There are so many more questions, but I am at time. So I just want to say thank you very much to our panel. So thank you very much, Steve, Maria, and Dawn, for sharing your experiences and being candid with us. I also want to say a big, massive thank you to the Health Innovation Network. And I want to shout out in particular, I want to say thank you to Anne and Noosh, who are constantly just holding and catering to myself and Katie. I think one of the things that people said is, what do you do to support people racialised as black and brown? What do you do to support the black women? Yes, Katie and I do what we do, but if we didn't have the support system in the physical embodiment of the people, what Noosh and Anne provide is not on a job description. It's the late night phone calls, it's the voice notes, it's the let's get some dinner together, it's the tears that we share in holding space. And I think sometimes that gratitude is said after. Sometimes that gratitude needs to be said now. So a big, massive thank you, Noosh and Anne. I want to say a big, massive thank you to Black Mothers Matter. I know, obviously, Ruby, you're there representing, but if it wasn't for the germ of an idea, we wouldn't be where we are today, so that's important. And I couldn't finish without saying thank you to my co-pilot in the name of Katie. Yeah. So thank you very much. So thank you for listening to us today.